Good evening and welcome to IHW Council's special web series on Rh negative incompatibility. I'm Anisha Nair Dhawan and you're watching our exclusive show on Rh negative blood group and its impact on pregnancy. A healthy pregnancy is a celebration for the entire family to welcome a new member. But there are a few things that would-be parents should be aware of when starting a family. One of the issues is Rh incompatibility. This occurs when a pregnant woman whose blood type is Rh negative, for example, B negative, is exposed to Rh positive blood from a fetus, for example, say B positive. Because of this incompatibility, the mother develops Rh antibodies, which have the potential to cross the placenta and attach or destroy the fetus's red blood cells. This causes the fetus to become anemic. In severe cases, the baby may need special blood transfusion called exchange transfusions, either before birth, which are the intrauterine fetal transfusions, or after delivery. Our show today is special as we're going to talk about Rh negative blood group and its impact on pregnancy. And to guide you for that and to answer all your queries on this, we are delighted to have with us Dr. P.M. Gopinath, Director and Senior Consultant, Obstetrics and Gynaecology, Institute of Obstetrics and Gynaecology and IVF, SIMS Hospital, Chennai. Welcome to the show, Dr. Gopinath.
Good afternoon.
Before I begin our conversation, I would request all our viewers online to keep sending us your questions as you listen to Dr. Gopinath. And if you have any questions that come up to your mind, because he's here to help answer all your queries over the next 30 minutes. So make the most of the time that you have with Dr. Gopinath today. Do like and comment with your feedback and also share this page on your wall if you think there are some friends or family members who too may get benefited from the discussion that we have today. So let's begin, Dr. Gopinath. Now, in my introduction, I try to explain, and I understand as a layman what Rh incompatibility is. Now, say the mother is Rh negative, like she's B negative. How come her baby becomes B positive? What is the chance? Because, the baby's DNA comes from mother and father. So what is the chance that mom will be Rh negative and the baby will be Rh positive?
First, let me just tell you what is blood group. So there are so many varieties of blood groups. For example, ABO system, RH system, MN system, Lutheran system, Kelly's. There are various things. Among that, there are two major important points which we just take it is from ABO group and RH group. ABO's patient can be A, B, O, or AB. And each of them can have this RH factor, what we call it as an RH, either it is positive or negative. And if you take the overall, the entire thing, about 85% of them will be RH positive. And only 15% of them will be RH negative. That is both husbands, wives, all put together. And if you take that, predominantly the positiveness is seen in O, followed by A, and then followed by B, and then followed by A. The same way, if you take that 15% of the negative, most of them are seen with O group, and then followed by A, and then followed by B, at last A. For example, if you take a mother who's O positive, and she marries another husband who's O positive, there is absolutely no issue, no incompatibility either on ABO system or an RH system. Supposing if she is O negative, that is the 15% I have said, if she happens to be a O negative, the husband has to, in case if he is positive, there again, depend upon the dominance of that particular system. So, if he has got a very dominant gene expressing a positive, and his offspring will always be positive. And if dominant gene is not there, what we call it as a small d and capital D. So if it is dominant G is not there, he can produce either a positive baby or a negative baby. He can express it or he can think. So if you have a negative mother with the positive baby, it is not always the baby, the positive husband, it is not always the baby will be positive.
Positive.
Baby still can be negative.
Okay, so what you're saying is, doctor, of the entire population, only 15% have the negative RH. And of this 15% population, it is the women who have the negative RH who should be watchful when they're starting a family, should their partner be RH positive, right?
Exactly. All the RH negative women, even before their marriage, if they have just seen their blood group and noted as an RH negative, they have to be very watchful. And they can marry an RH positive. It doesn't mean that they have to select only for the RH negative group. They can marry, but they have to bring it. If at all, as we go on, when I explain, you will know it does not affect all the pregnancies. So
yes,
they
it
can,
doesn't affect all the pregnancies, and
they can get to a
it
normal.
shouldn't. Yeah, it shouldn't affect your choice of life partner as well, because there are treatments available, and the chance is, like you said, it depends on the dominant gene. So they shouldn't perhaps be a deciding factor for choosing your partner, because there are treatments available if there is an incompatibility. But in all likelihood, unless there's a very dominant gene, it may not be a problem, right?
Yes, absolutely right. But the problem is when they are planning for a pregnancy, they have to go for a consultation.
Yes, that
So
is
they
very
have to
important.
tell them, say, look here, my blood group is O positive. My husband's blood group is A1 positive. I am planning for a pregnancy. What are all the precautions we do? When I conceive, what are all the things we do? They should know the the impact of the RH system on the entire pregnancy. What it can do, what it cannot do, in what way they can be vigilant, what are all the precautions they have to make sure it is taken to avoid the complications.
Right, but Dr. Gopinath, how much awareness exists about this? I mean, the last thing on my mind when I'm looking for a partner is going to be, what his RH, blood RH is. I get married, and then we're all happy, and we have the happy news starting a family. So, what is the level of awareness amongst patient groups and even physicians? I mean, I'm not RH negative, but during both my pregnancies, the physician was, I mean, she never even mentioned it. So, will they only mention it to women who are RH negative? Is there enough awareness about this?
Yes. If the say the moment you become pregnant, you go to the obstetrician, and when they do it, and if it is negative, they will inform. They will talk to you, saying that you are negative. Please bring your husband. We will do the testing for him. So they will do the testing, and then if he is positive, then they will put it across to you. For example, if you are positive, why confuse you with all the information? The same way, if you are negative, if your husband is also negative, then why confuse you with all the issues? So that is the reason they do not scare you with the blood systems when you just go with the pregnancy in the beginning.
Okay. The other question that I have is, Dr. Gopinath, that sometimes what I've understood is that during your first pregnancy, even if you don't know about this, it may not even impact you or the baby. But subsequent pregnancies become a little risky if you don't take timely action. How does this work? How does this work out?
Yeah. See, the disease or the pathology is the mother is negative. So if the baby happens to be positive, so what actually happens is there is a transplacental exchange of blood. So the mother is being pumped with positive blood. So if there is a positive blood in a negative mother, so she starts preparing an antibody for the positive. So this preparedness Probably it takes about 9 months before that the patient delivers. So that is the issue. And then after that, after the delivery, there will be a lot of antibodies. If you take precaution, give appropriate the antigen, then you will completely destroy it. She becomes a fresh woman again to start with that. So that is the main key issue. So, for example, if the patient is not even delivered, this is the first pregnancy, they do a lot of things. They do an amniocentesis, they take out the blood for some various procedures, and they do some maneuvers. And all this will help in building up even in the first pregnancy.
No, I'm still trying to understand, Dr. Gopinath. Ambulances is not considered very safe. So, I mean, why would you go ahead with something like this? I mean, what do you,
Amniocentesis.
yes, why, what do you hope to achieve out of it? Plus,
Amniocentesis.
one more question, Dr. Gopinath. I thought, the placenta is one, which is a connection between the mother and the baby for the transmission of nutrition and the removal of waste. So, where does blood exchange come from? The baby has his own blood, and mama has his own blood, her own blood. So, where does the exchange happen?
Fine. So, the first important point, when you just mentioned about the placenta, it has got a barrier. There is a blood barrier which only the nutrients, oxygens are being required. For example, if she has a slight abortion, some small bleeding in the 3rd month of pregnancy, so this blood makes the possible, breaks the blood barrier, and then there is an exchange. That is one. Second is, as I've said, amniocentesis is not the routine test we do. Very. When you feel there is something major issues with the baby, which you want to test it, prove it, and allow her to continue the pregnancy, that is the place where they do the amniocentesis. When you do the amniocentesis, probably it increases the bleeding. There is an exchange of blood. So when the exchange of blood, when the fetal blood, when it crosses to the mother side more than 4 ml is the issue where all the disease process starts taking.
You mean the antibodies start getting formed if the transfer
the
is more than 4 ml of
mother
blood?
Starts developing the antibodies.
Okay. We've started getting a few questions, Dr. Gopinath, and one of the Facebook users is asking us, how does the RH factor affect one's pregnancy? Now, you said that you can do the amniocentesis, but what would trigger you to do this? Would there already be some impact on the baby that you notice in an ultrasound or something? Then you consider this invasive test. How does this impact one's pregnancy?
The importance is the amniocentesis, it is done in a very, very limited number, not routinely in all pregnancies.
Yes.
When you feel the risk and benefit of doing amniocentesis, the benefit is more, then they go for the pregnancy. For example, a Down syndrome, when they have done a scan.
The blood work also, right? For Down syndrome.
When the scan is being done on 12-week size, there is some markers which says this baby may be a Down baby. Then the second step is they do the blood test. So even in the blood test, there are some issues. Then they prefer to do an amniocentesis.
Okay.
And about the impact on the first pregnancy, normally it does not affect the baby. They go through a normal delivery. Babies will be mostly unaffected. For example, if the baby is in an upside position, they try to maneuver and move it down before the delivery. It increases the maternofetal hemorrhage. So the antibodies will form. Normally, the head comes first in the delivery. And if the head is above, what we call it as a breech delivery, the bottom first. So we can try to move above from the abdomen before delivery and make it into a normal process. This is called external cephalic version. When you do this version, there is an incidence of hemorrhage. So RH isoimmunization takes place even in the first pregnancy.
Mhm. Right. We have another question, Dr. Gopinath. Facebook user is asking, do all RH negative moms get RHOGAM? I'm not sure what is
Yeah, this is a
RHOGAM.
ROGAM. So this
ROGAM,
ROGAM
yes.
is an antigen which is injected to the mother. So when she is RH negative, when she delivers a RH positive baby, and then this injection is given in the first 72 hours. That is number one. When before the delivery, when she has undergone an amniocentesis, we give a prophylactic dose. Or when they have done an external cephalic version or some procedures, then at around 28 weeks, we give another dose. So antenatally, we can give prophylaxis with ROGAM. And normally, after the delivery, within 72 hours, we give the final dose.
Okay, but I think the question is that is it given to all RH negative mothers, or is it
All
only given to
RH
those?
negative mothers who has delivered the positive babies.
So you have to first determine the blood group
Exactly.
before you give this, right?
Exactly.
So
not only that, and we also do a thing called Coombs test. Coombs test will tell us how much of the baby's blood has gone into the mother and produced antibodies. So based on that, we do it. Coombs should be negative, then we just give it. If the Coombs is positive, then there is no point in giving it. They do not give it. So first is, number one, mother has to be negative. Number two, the baby has to be positive. Coombs test has to be negative. Then they give it.
Right. Now, one question again here is that, if the mother feels that, she doesn't want to have another child after this pregnancy, then would she be given the antibody injection?
So this is a very good question. So because RH, we always feel that it has been associated with the childbirth, they do not give it. But for example, if that lady thinks that she is not going to have another child, she gets even sterilized. That is, permanent sterilization is taken in order to avoid the next baby. She can get into some transfusion later on, right? So for some other reason, she may need a blood transfusion. So that time it should not create an issue. So that is the reason we feel this is not only for the childbirth, whatever is the immunological reaction which has taken place in the mother has to be neutralized with the antigen.
Okay. Right. We have another question saying that how is RH incompatibility treated? You told us about the antibody that is given. That is for the mother. What happens to the baby? I said in my opening remarks that, the baby could be affected, could have anemia. So what is the treatment for RH incompatibility?
The baby can be affected by three ways: mild, moderate, severe. When the baby is mildly affected, what actually happens is there is a breakdown of red blood cells there. So thereby the hemoglobin, the bilirubin will be increased. So baby will come with jaundice. So when there is a jaundice in the mother, there are some phototherapies are there. Then they give phenobarbital tablet, and then they make sure that the breakdown, the protein, the bilirubin is brought down, and then baby can survive without any issue.
So, doctor, just for clarification, this is jaundice in the baby, right?
Yes. We are talking only about the jaundice in the baby. Okay. So the second is, if there is an excessive blood destruction, not only the hyperbilirubemia, not only the jaundice, baby also goes in for anemia. Baby becomes pale. She is papery pale. At the same time, it is born with yellow tinge. So in this issue, probably baby will need a transfusion, and then they will need the phototherapy, and then the head has to be monitored. This is the moderate variety. The severe variety is where the bilirubin content goes more than 12 milligram per ml, it can affect the brain, what we call it as a Kernet stress. So it can, later on, it can have hearing loss and very severe effects can be there. And in the worst case scenario, there may be what we call it as a hydrop. The baby becomes bloated and it's practically, it dies within, it becomes anemic. So these are all the things which can happen. The treatment can be started in utero or after the delivery. In utero, we can give a transfusion. Blood transfusion can be given through the ultrasound guidance. Thereby, you will correct that position. And when it is born outside, we can just do a phototherapy and then we give a transfusion, exchange transfusion, it can manage.
Right. We're getting more questions. First of all, there are some worries about mothers that will this cause a miscarriage? Just that she is Rh negative, the baby is Rh positive. There may not be a exchange of blood, but what is the risk of miscarriage?
See, the important thing is if there is a miscarriage, the miscarriage can occur in the first 3 months or in the fourth month. If it is in the first 3 months, you may not know the baby's blood group because the baby is not formed. A blood group is not formed. So, for example, if there is a tubal pregnancy, pregnancies will be operated in the second month itself. That time, nothing will be seen. So, those cases, we presume if the husband is positive, if the mother is negative, we presume it is positive and give them the antibodies. Antigens, Rh antigens will be injected after the ectopic surgery, after the miscarriage, they can take it so that it neutralizes whatever the antibodies which has formed. So mother is back to normal.
But is there a threat of miscarriage after 3 months?
In spite of the miscarriage, soon after, within about 3 days, within 72 hours, you give the injection, antigen, and then it neutralizes. The mother can come back to the normal pregnancy again.
So the next pregnancy will not be threatened.
Absolutely
at all, right?
normal. Absolutely normal. There are some tests there. We do the blood test for the mother to find out is there any antibody titer which is happening, and then we can just take it.
All right. One of the Facebook users is asking, is Rh sensitization permanent or does it reverse after some time?
If you're not neutralizing it with antigen, then it is permanent. It is permanent. So that is the reason we wait for about some 72 hours, give the antigen, and then neutralize it, and then we nullify it, and we make sure that there is no sensitization. If you do not take the precautions like this, then it becomes a permanent. Say, for example, 2 deliveries, she is not aware of it, she is not given it, then it becomes a problem.
Yes. Thank you, Dr. Gopinath. I hope you can hear me now.
Yes.
Yes. So one of the other questions that we have received from the users is that, is Rh blood grouping genetic? So if I am, as a mother, Rh negative, will I transfer this, to my child? We're discussing the incompatibility, but what is the chance the negative blood group gets passed on genetically?
See, we started with the discussion saying that if the mother is negative, if the baby is positive, then there is a reaction. That means it is not genetically transmitted.
Okay, that's great. One less worry for mothers there. What about the husband? Does the husband take any treatment at all? Is it even required?
Husband does not require any treatment because he does not come in contact with the blood or antigen for the either with the mother or with the baby.
Another question that we are getting is, in which trimester of pregnancy is this therapy most effective?
Antigen, the
Yes,
injection.
the antigen.
Yeah.
Yeah.
Ideally, in the first pregnancy, we do it between 28 weeks and 34 weeks is the ideal time to give the antigen. And if you fail to take it soon after the delivery, within 72 hours, you have to give it.
Right. And what about the treatment for the baby? You said that there are gradings of the severity of the cases, right? So, what is the treatment given to the baby according to the grading?
Yeah, soon after the delivery, they will assess the hemoglobin level. They will assess the bilirubin level. So if the bilirubin level is mildly elevated, they will give phototherapy. The phototherapy is something like a tube light, which they will just give us thing. Phototherapy can be given from single surface or double surface. Older days, normally we close the eyes with some small tape and then keep them directly under the sun or indirectly under the sun. That is the treatment. So that in the form of a phototherapy, we give it and we keep monitoring repeated hemoglobin level, the bilirubin levels. And then if need be, they give something like phenobarbital tablets to reduce the metabolism, to bring down the breakdown. It is very easily manageable, not a life-threatening disease, particularly when it occurs for the first time in the baby.
Right.
Second baby and third baby will be worst affected. The
Okay.
first baby, it goes unaffected. It can be managed.
What about the treatment for the second baby and the third baby when the mother has
If
formed
the
antibodies?
if
You
the
may have
mother
given her.
if the mother has given the antigen, there is no problem.
Okay.
Automatically it goes on. If the mother has not taken the antigen, second baby 50% it will be affected, and if the third baby 100% it will be affected.
Okay. So let's assume that the mother was not aware of this negative incompatibility. It missed the physician, and now she's in a second pregnancy, and the baby is getting impacted. Then what do? How will you treat the baby then?
Yeah, first what we do, even as she was becoming, during her pregnancy, we will look at the antibody titer, maternal antibody titer. If the titer is above one particular level, what we'll do, we will do a ultrasound. With the ultrasound, take the baby's blood and then assess it. The same time, we give exchange transfusion. Give a fresh blood, O negative blood to the baby through an ultrasound in utero, within the uterus. So that is the ultimate treatment, and it will make the baby healthy, get out of the issues.
Right. How does this happen, this in utero blood transfusion? How safe is it? And for the mother, does she have to be sedated? Is it like an operation? How does it happen?
Yeah. Mother can be easily talking. She can observe it. It is not the one single needle, that intramuscular injection needle, little thicker than that, will be passed through the abdomen. That area will be given a local anesthesia. She will not do anything. She will cooperate. She will be looking at the images and she will be seeing it, and she can see it alive. It might take about 3 hours or 4 hours for the people to do it, but she will not undergo any issues.
Pain.
She
Okay.
can even take fruit juices in between if she wants it.
All right. Another question that we've got is, can RH factor cause birth defects in babies?
Usually, no. It does not cause a birth defect. So, in case of severe RH incompatibility in the previous child where it is not immunized, it can result in neurodevelopmental disorders, but not birth defects.
What are these neurodevelopmental disorders?
Mental retardation, hearing loss, is the two commonest things which occur with RH isoimmunization.
Right. Another question is, what are the symptoms of RH incompatibility?
RH incompatibility does not have any symptom. See, the moment you become pregnant, when you just go there, if the first thing they do is a blood grouping.
Mhm.
So in the blood grouping and RH typing, if you are negative, they ask you the husband to come. They'll do the blood grouping for him. And if he is
Right.
positive, they'll put one red mark in your antibody sheet and then just follow it up.
All
It's
right.
very simple. And even say we have been doing this process for more than 50 years.
Okay. So basically, counseling happens, and then the patients are managed very actively.
Exactly.
Right. Yeah. Another Facebook user is asking, can RH negative blood cause health problems, like to the mother? I mean, would it cause health problems to her at all?
It is something like a labeling of your blood group system. So if it is negative, it does not mean that she is deprived of anything. She is normal, healthy, like any other positive woman.
So basically, she's regular only when she has a baby who is RH positive. Does she need to be careful? The baby will also be fine, but she has to be careful.
She has to take precautions for the next baby. That is all. You need not worry about it. If you are RH negative, don't get panic, don't get scared.
Yeah, because treatments are there and it can be actively managed. There's another question coming in. Can two RH positives have an RH negative baby? I mean, both mother and father are RH positive. Can they have an RH negative baby?
Never, never. Because where does this positive negative factor come? So the mother has got a positive antigen, father has got a positive antigen. So obviously the baby will also be a positive antigen. It will never come with a negative baby. As I have said in the beginning, if the mother is negative, if the father is positive, still the baby can be negative or baby can be positive.
Positive, yes. So if negative, of course, it's not going to be a big problem at all. Now, one question that we have is from a Facebook user: what if a negative mother has aborted in 12 weeks of pregnancy and has not taken the antigen? How will it affect the subsequent pregnancy? And can it be useful for the second pregnancy if the antigen is started in the first trimester? So the woman had a abortion. She had a RH positive baby. She didn't take the antibody then, and she had a subsequent pregnancy. Then would you give her the antigen in the first trimester?
I understood the question. So the problem is when she becomes pregnant second time, who has not taken an antigen earlier, we do a maternal antibody titer.
Okay.
So this maternal, we will evaluate how much of the antibody this mother has developed due to the previous sensitization. So that level will tell us how far we have to be guarded. And the second thing is the antibody titer, the antenatal prophylaxis is given at around 28 weeks and 34 weeks.
Okay. Not in the first trimester.
And if the titers are very high, then antibodies have already formed. There is no point of giving antigen.
Okay. We have another question. Does one have to get Rogam shot in every pregnancy?
Yes. If it is negative, every pregnancy, the baby has to be tested and then the mother has to be tested for a Coombs, whether the antibodies have developed or not, and then she has to keep on taking it.
All right. Another question from a user is, does the father's blood type matter in pregnancy? I'm sure it does.
No, as long as the antibody or RH isoimmunization, it does not matter. But without a father, we won't be able to just get the pregnancy.
That is also true. One question, another question that we are getting is that can it cause health problems for the mother?
No. Mother will be healthy. It does not have any increased incidence of any disease or pregnancy complications.
Okay. And the the shot that the mother gets, does it have any side effects? Could it impact her health at all?
It is very simple, just like a tetanus toxoid. It will be given and there is no side effects. And there is, so far, I have not heard of any untoward side effects of an RH antibody.
One question that I have is, Dr. Gopinath, why do we have to get the Rogam shot in every pregnancy? Say, you give if I develop the antibodies and I'm given the shot, doesn't it get neutralized forever? Why would I need it subsequently in every pregnancy?
Because the second pregnancy, through the second baby, you are going to sensitize again.
Oh,
So
you
then
get it
after that,
again.
yes. Then after that, you need the shot.
Okay, so basically you have to test for the titers and then see whether it's
Test the
required or
baby's
not.
blood group, see whether the immunization has taken place, then you have to just give.
All right. So a few steps on the way, but the thing that Dr. Gopinath has clarified is, we're getting another question whether there are any side effects of Rogam shot, which Dr. Gopinath has said there are none. But you may need them repeatedly in subsequent pregnancies, because with each pregnancy you may be developing the antibodies which have to be neutralized. So testing is to be done, and then the physician will take a call on what is to be done. So Dr. Gopinath, you had mentioned that as a treatment for the fetus, an intrauterine blood transfusion happens, and you describe the procedure. Can this be done immediately after birth as well? Will it suffice?
Yes, we do. Soon after the birth, we look at the hemoglobin, we look at the bilirubin. If the bilirubin is very high, we do an exchange transfusion outside through the umbilical cord. The umbilical cord has got a vein and artery. We put a plastic cannula into the umbilical cord and then give an exchange transfusion outside. It can be done outside.
All right. Dr. Gopinath, there is another question that is coming up. A Facebook user is asking, is it necessary to do ICT test while having a MTP or surgical MTP while mother is negative and a partner is positive? Is it required to do this ICT test? I don't know what the ICT test is.
ICT
so you can explain it.
Indirect Coombs test. So we don't have to do it. If the mother is negative, if the husband is positive, after an abortion, we can just directly give an antibody, antigen. Directly we can give it within three days, 72 hours. The indirect Coombs test need not be done.
Okay, it's not necessarily done.
Yes.
But the antibody shot may be given to the mother nevertheless. So we've taken up a lot of questions in the show today, and thank you so much, Dr. Gopinath, for joining us and answering so many questions. All those who joined today, who've had so many questions, have, I'm sure, got a lot of answers today, a lot of clarity on how to handle this. Just one last thing that I would like to ask you is, Dr. Gopinath, if you can say one thing to everybody watching. Some people get worried about, RH negativity, it's really bad. So what would you like to say to the viewers about RH negative incompatibility?
First of all, RH negative is yet another group. You need not get panicked by looking at the blood group. That is number one. Number two, if you are negative, that is 15% of the population is negative. Out of that 15%, say about 40% will be in the female. So altogether, around 7% of the female may be negative. And if you are negative, beware that you are negative, and then inform your consultant when you plan a pregnancy. So they go through it and be aware there is no major issues in the first pregnancy, and it is always the protection is given only for the second pregnancy. So you will go, even if they have not done the Coombs, if they have not done the proper scan, you will still go through and then deliver a baby without any issue. Soon after the delivery, what injection you take, the antigen, is only for the protection against the second baby. So don't worry about it. It is just a variant where you have to have an extra vigil and then inform your obstetrician, and that is all. Don't get panicky with the RH, and we have a boom. The antibody is here, antigen is here. So it can be given even during pregnancy. make sure that you don't get any other complications out of it.
Right. Dr. Gopinath, thank you so much for joining us today and answering all the questions that you've taken up. So that was Dr. Gopinath from Chennai answering all your questions on Rh negative blood group and the incompatibility during pregnancy. If you have more questions, you can send them to us through our WhatsApp. You can click on the WhatsApp button on our page, type in the questions, and we will take up the questions when we return with another show on Rh incompatibility. Now, don't forget to follow us and stay updated on all the concerns about your health and well-being. The ISW Council page has a lot of information for you to follow, which really is very helpful. This program was supported by Bharat Serums and Vaccines Limited under its Public Awareness Initiative. We'll be back with our special show on Rh negative incompatibility next week, same time. Do follow us on Facebook and get all the updates on our upcoming programs. To keep sending us your questions, and we'll certainly include them in our next show. Till then, stay at home, take care, and be safe. Goodbye, and see you soon.
Thank you, Anisha.